Hello.
Hello.
How are you?
I'm fine. Hi, Rachel. I'm Sandra. Nice to meet you.
Nice to meet you as well. I have, Marielle is waiting to be let in, and Eva, there you go. You got it. Sorry.
Oh, we're good. We're good. A little help is never bad. Okay. So let's just give it another minute or so to see if someone else is going to join us, and then we can get started. How are you?
Doing well.
Good, thank you. Hi, Sandra. Nice to meet you.
Great.
Nice
Hi.
to meet you.
And Evilise, you as well.
Hi, how are you? Nice to meet you both.
That's right. You have not met the team
Yeah,
yet.
I had
We've got to work on that.
Well, now everything is virtual, so we feel like we know each other, but we don't really. It's funny how things work.
Yeah.
I'm just gonna see how many people registered. Seems I can't do that here. And so that you know, I'm gonna be recording the session because there are some people who register, but then they can't join, but they are definitely interested, and that's the reason why they registered. So I'm gonna record the session, and then after we're done with the webinar, I send the recorded link so that people can see the presentation, and it's gonna be up on YouTube. Actually, we have a YouTube channel for our community chats, and then they can, you know, as people are interested, like you can promote your program or whatever it is, I'm gonna send you the link. That way you can send people to that link and more people can view the recording. So that's a good thing. It's gonna be permanently there, and you know.
That sounds great.
Yeah.
Are you guys getting feedback from me? Because I can put headphones on if it's.
Little bit in that last one. I wasn't hearing it before, but then you mentioned it.
I hear you just fine, Rachel. I wouldn't worry.
Oh, okay.
Yeah, see, now it sounds fine.
Don't worry.
I think you're okay.
I'll mute myself often because you hear a train where I live, so I keep myself muted most of the time for those reasons.
Okay. So just to be respectful of people's time, I'm just gonna wait till 12:05 and then I'm gonna start, okay? And I'm gonna mute my phone too, otherwise it'll be ringing over the. Good, so welcome and thank you for being here. I don't know for you, but it's definitely been a hectic week for me so far. So this 2021 is already hitting us hard and lots of work, but lots of great things also happening for 2021. And one of them is this new CARE program that we're going to be talking about today. So I have great panelists, as every week I do, and I'm just going to read a little bit about them before we start our known Q&A discussion. So Rachel Rivera, hi Rachel, She has a bachelor's degree in adolescent English education, a master's degree, and a clinical license in social work, and holds postgrad certifications in creative arts therapy. That sounds very interesting, and dialectical behavioral therapy. Rachel has 9 years of experience working in residential foster care, as well as experience working within the children's welfare system, and 3 years experience working with adults who have intellectual developmental disabilities. Currently, Rachel is the Children and Family Services Director at Access Supports for Living, where she is the co-creator and facilitator for the Access Stands Down for Social Justice training, as well as a facilitator for LGBTQ+ cultural humility training. We need to talk about that too. And CARE, Children and Residential Experiences training. In addition to her work at Access Supports for Living, Rachel is on the board of directors at the Newburgh LGBTQ+ Center, and has also co-created and provided guest lectures at Mount St. Mary's College on topics of power, privilege, and oppression, gender and sexuality, and Queer Theory 101 LGBTQ+. Wow, impressive. Evelise, where are you now in my screen? Has an associate's degree in liberal arts, humanities, and social science, a bachelor's degree in liberal studies, and a master's of science degree in mental health counseling. Evelise has only 19 years of experience working with children, adolescents, and adults in psychiatric and correctional settings. Evelise also holds an early childhood certificate and has worked with infants, preschool, toddlers, and elementary school aged children as a teacher's assistant. Currently, Evelise is the clinical for mobile rehab and stabilization service team at Access Support for Living, servicing families in Rockland County. Last but not least, Mariel Piña. Piña, like the pineapple, right? Mariel Piña, delicious. Is the children's LGU representative and children's SPOA coordinator at the Rockland County Department of Mental Health. After getting her bachelor's degree from Wesleyan University in Connecticut, she lived abroad in Spain for many years, working with children on improving their English skills and her Spanish skills, of course. She then returned to the States and pursued her MSW at Hunter College School of Social Work, where she specialized in clinical practice. I'm a Hunter grad too. Okay? After some years working as an OMH care manager for an HCBS waiver program, Mariel became part of Rockland's Department of Mental Health, where she worked in the mental health clinic doing individual therapy with children and adolescents before it closed in December 2019. She then continued in the role of Children's SPOA coordinator, as well as working at the Partnership for Safe and Healthy Youth Center. Mariel has extensive training in trauma-focused models, including certification in trauma-focused CBT and dialectical behavioral therapy skills training. Most recently, she became a certified alcohol and substance abuse counselor. She's constantly working to build her own awareness regarding racial and social disparities in mental health practice, and she hopes that all practitioners strive to use an anti-racist lens in their work. Social work is social justice, she says. Okay, talking about having experts among us. Girls, you got it all. So let's start, Mariel, maybe you wanna tell us, who are you? What do you do? What do these agencies that you're working for?
Sure. So again, thank you so much for having us, and Sandra, thank you for organizing this. We're appreciative for getting the word out about this great program throughout the Rockland community. So we're here to answer any questions, of course, as well afterwards. So I, as Sandra mentioned, I work at the Department of Mental Health, and my specialty is with the children and adolescent population. Department of Mental Health does a variety of different things for the county. We provide oversight for our clinics here, our Article 31s. We also provide oversight for the substance use services that we have here in the county, and work with contracting and work directly with OMH to ensure that we're filling all the gaps that we find in the county and that we hear from the families that we work with. Really, that's really our goal. And I think that's one of the main things that a lot of what you'll hear today is about, really filling one of a big gap that we had been hearing about in the county. Really, what can we do for kids who are in kind of a constant low-level crisis? What can we do to help them, really, and support the families in that process? So, I'm very glad to be joined here by Rachel and Ivelisse today. They are from an agency based in Orange County, actually, but they are, spreading their wings and spreading out. And we're so appreciative to have them because Access Supports for Living has so much experience in the mental health field and specifically really in this mobile response and stabilization service. So, they're really going to be the experts on this, and they can tell us a little bit more about what Access does. Because again, their Access Supports for Living is a huge agency and provides so many services across the Hudson Valley, I think, in general. So I think, if we can, maybe Rachel can talk a little bit more to what Access does now.
Yeah, of course. So, like you said, we have quite an array of services, mainly in Orange County, but we serve Orange, Dutchess, Columbia, now Rockland, and several other counties. I think we're up to 11 counties. So it'll be like naming the dwarves. If I try to do it, I'm going to miss one. But we are in the Hudson Valley, definitely, with our feet well planted. And, as Mariela said, we do have experience with providing mobile mental health in both Orange and Ulster counties. We have a 24/7 substance use urgent care that is virtual, and we'll serve anybody in the Hudson Valley. We have community clinics in Middletown and Newburgh, IDD, intellectual and developmental disability services, residential day hab, and community hab services, that is. And then we have a wide array of children's welfare programs. So not only the residential foster care, but preventive, CFTSS, intensive preventive. So we have like PINS diversion, FINS diversion programs, and transitional support for youth who are aging out of foster care into the community.
Wow. Okay. How did this idea of care started? Care, children, and residential experiences. Obviously there is some need, but do you want to tell us a little bit about the history?
So I think care, we have two different care. So one is our care team, and another one is what Rachel had, was in her bio about a training or something that she has created. So our care team here in Rockland stands for Community Assistance, Response, and Engagement Team. And that's kind of what we want to focus on today, of course. So in 2016, Rockland County was lucky enough to receive a SAMHSA grant, substance abuse and mental health grant, really, from the federal government, $4 million grant to use over 4 years, which, for a tiny place like Rockland is a lot. Yeah. So we were very excited and a little bit surprised, really, that we were fortunate enough to receive that grant. And so one of the main things that came out of that grant was what we call the Partnership for Safe and Healthy Youth. That is our system of care, the name for our children's system of care. And, if you have any experience in the mental health world, system of care really is just all the providers that provide services to children in our community, and really breaking down the silos so that we're all working together as best as we can to support the children and their families. That could be schools, the clinicians, the support service providers that are going into the homes, the care managers, probation, social services, mental health, right? Everybody just working together to really provide the right services for the children. So we've been really trying to expand our system of care here in Rockland to include as many providers as we can. And if you're on this call and you're not sure about the system of care, please contact us so we can, bring you in. And one of the other things that came out of it was our center, the Partnership for Safe and Healthy Youth Center, which is a place where we have multiple departments within the county sitting together and working together on cases, which is really an anomaly in this world nowadays. We have, again, like I said, everybody works in their separate silos. So to be able to come together and share information readily with each other without having constraints, HIPAA constraints and things like this, because we have universal consent forms and things that allow us to really communicate better with each other. So at the center, we have the Department of Mental Health, myself, we have Department of Probation, we have Department of Social Services, and we have our BOCES, and BOCES has a very large role here in Rockland County. So it's been really great to be able to, again, just to break down those barriers and work together. I think a lot of the times, a lot of things that we've seen over the years in our country come down to the fact that people aren't communicating. A lot of this original idea came from our district attorney, Tom Zugabe, back in 2013. He started to put together some meetings with all of these players because he was very affected, as we all were, by the Columbine shooting, and how after everything was said and done, all of these different agencies had eyes on these kids, but nobody was communicating with each other. And so, for us to be able to kind of break that down is really, really important. And, I'm grateful to be a part of it for sure. So, that center has grown and we continue to work together, and it's going to continue on now, even after this grant. And then as we started seeing more and more families and understanding more of the gaps that we have in our community, it was clear that we needed something else. We have our BERT team, the Behavioral Health Response Team, run by Rockland paramedics, which is great for imminent risk and for those higher risk cases that we get, kids who are self-harming, kids who have suicidal ideation, or even maybe talking about a plan or an attempt. BERT is a great resource for them. But there was still that kind of, again, that lower level crises that we weren't responding to appropriately, right, or adequately. And so when we started to research more, there was this model already invented, the Mobile Response and Stabilization Service. So of course we say, why go against something that's already invented? Let's just use that and make it better and make it for Rockland. And so we had, thank goodness, with this grant money, we had some extra carryover money, and we were able to, contract with Access Supports for Living after some discussions and things, and now we're here, and the program has been up and running since December 15th, and we're really excited to see how it continues and how we can sustain it to continue on for hopefully many years to come.
Hopefully, yes. I mean, these are definitely services that are greatly needed. And I know that, some people listen to us as far as, Bergen County and the Bronx and all of that. So what makes children eligible for these services?
So really any child 0 to 21 is eligible if they are in whatever they define as a crisis and it's affecting the family. That is something that we often explain to whoever the caller is, whether it's a parent or guardian or school, as far as being a crisis, right? Because we have this heavy word that generally relates directly to the work that the BERT team is doing. So when we talk to families, we're really saying, if you have something that is exceeding your ability to cope right now, and we can help you get through it and get to baseline and make a plan with your family to be able to continue the service, that's all it takes to be eligible.
Can you give us some example of some of the crises that people come to you with? Because you just said it, it's whatever they feel is a crisis. So what are some of the types of crises that you have encountered?
So I know Evelise is on with it. The biggest one you would say is right now school attendance, especially with COVID and remote learning.
School attendance with COVID and remote learning. A lot of the adolescents are having trouble keeping up with the schoolwork. And also
Mhm.
a lot of the adolescents are having trouble actually putting their camera on, which they don't want to attend school because they don't want to look at themselves on the screen with others. And one of the requirements, turn your camera on. Not everybody wants to be seen on a camera, especially adolescents who probably are going through their own developmental changes and they don't understand what's going on. So they don't attend class. Another issue is a lot of the parents can't help the younger ones. They get locked out of the system. So since September, they haven't been doing their work because they call the school, they fall under the radar, and the parents don't know what they're doing. The kids don't know what they're doing. So attendance have been an issue and schoolwork has been an issue.
So it
Another,
can be as simple as helping them learn how to do, like, get into the system and get in and be able to follow up with them a few weeks later, you know, 2 weeks out and say, how has school been going since you learned how to do this? Have you been able to attend? Has your child been able to attend?
Mhm.
Mhm.
This-
Do you have to be a Rockland County resident to access the services? Can you come from another county?
Yes. So because our funding is coming from the Rockland DOH, we do have to be a Rockland resident.
Mhm. Okay. Now, so all the funding, obviously you have the funding. So how are these services paid for? Like, do families have to pay anything, or do you request an insurance?
So the service is a free service to anybody who would like it. There, you know, at some point as we're looking towards sustainability, there might be some billing for, you know, Medicaid managed care, but nobody will ever be turned away because of an insurance issue or an inability to provide the information. You know, even in some of our other programs where Medicaid managed care is necessary, it's really hard to get the amount of documentation that can be necessary, and so that can be a deterrent for people if they've tried to get services elsewhere. We understand that.
Mhm.
If we can't do that kind of billing, then we just won't be able to do it, and they're still going to get the service.
Yeah, I think that's an
Okay.
important point, right? Because we're really looking to service all of Rockland County, and we understand that anybody can have a mental health crisis, right? It's not just you know, rich people, poor people. It's not, you know, it's
Yeah.
across the board. You know, mental health is something that truly cuts across all, you know, all economic, everything, you know, class, race, ethnic, you know, all of it. So we really are dedicated to allow, you know, to keeping this service for everyone. And like Rachel said, you know, maybe in the future we will look into, you know, billing insurance and stuff, but that doesn't mean that people without insurance won't be able to access it. That's our hope.
Yeah. Okay. Why, if one of you can just walk me through the process, you know, I'm a mother and, you know, my child is having a crisis of some sort, like you said, with the school or something, you know, and I hear about the care team, you know, somebody says, well, the care team can help you. What do I do? How do I get to you? Like, what will be the steps? Like, if you can walk me through that so that people who watch this video say, okay, now I know what to do, where to go, you know, like, I can do this.
Absolutely. So if you are, say you're the mother, you're going to call the behavioral health response team, the BIRD team for Rockland. So that number is 1-845-517-0400.
Wait, I'm trying to type it in the chat box.
Oh, okay.
1-845
517
517.
0400.
Got it. Okay.
And you'll reach the BIRD team with their dispatchers like a normal BIRD call. When you talk to them about the care team, they'll collect your information and pass it to our team. because first what they're going to do is screen for acuity, see if there is an emergency, something that needs to be handled in the moment, you know, a suicidal ideation or homicidal ideation, something that would require a family to go to the
Immediate.
hospital for a safety issue. And as long as that's not something that's in the immediate, because if it were, they would take care of it, right? And still probably put a referral out to us so that we know if you need help in the future, we can intervene. But they'll send us a referral that'll with your name, so your name, number, so that we can contact you back, address, so that, you know, if we can't contact you back, maybe we do a well visit if it's appropriate. And, you know, please answer your phone if it comes from a number that you don't recognize, because we will be contacting the bare minimum within 24 hours. We're really trying to keep it down to an hour or two. However, the team is working 12 p.m. to 8 p.m. So depending on what time that call goes into the BERT team, you know, it might take us some time to get back. That being said, when we call you, we're going to ask, you know, what's the history of why you're contacting us, and how can we help? You know, what's the goal of the call? What's your crisis? We'll do a COVID screening. If you're comfortable with us coming into your home, we will come into the home if it's appropriate. We've had families that are like, I'm not comfortable with COVID. I'm not comfortable. I have family members who are at higher risk. And so we offer a Zoom call, and we can meet with the family via Zoom. When we do that outreach, we're hoping, whether it's in person or on Zoom, to have as many of the family members present as possible. We like to hold a family meeting, see when we're talking about how the crisis is affecting everyone. If a crisis for one person truly does affect the whole family, and we're interested in how does that work and what are the dynamics? What does everybody need to be able to get back to whatever the family's normal is? The team that goes out is a clinician and a family peer advocate, so that we can provide therapeutic services and provide some peer services. A family peer advocate, for anybody who does not know, is a person who works with families with a certification, who has experience raising a child with a mental health disorder. So they can relate with the family, and they can, you know, describe how things that they've tried have worked, or even just providing that empathy very often is very helpful. From there, we create a plan together. It's really, truly a child and family driven service. We're going to ask why do you need us here? Because we want to provide that service. We're not going to come into somebody's home and say, you need to work on this, when really you're telling me that something else is the issue. And then from there, after we create that plan, we'll schedule a follow-up. We'll come back. We'll, at the end of however long the intervention is, you know, we do have a stopping point of 8 weeks, but we can stay involved in up to then and come back as frequently as needed. And we'll recommend a level of care, whether that's giving a referral to another service that's more long-term, or helping to set goals with the family and create a plan for avoiding future crisis or hospitalization. And then we try to do 2 follow-ups. So 1 2 weeks out from the last intervention, and then another follow-up about 2 weeks after that, to just make sure that what we did do is still working. Because if it's not, we'll go back to the drawing board and start over.
Just one question, Rachel. Do you need to have a mental health diagnosis to reach out to you? No. Okay. That's what I thought. Now, as I said in the beginning, you know, we're recording this session, and it's going to be uploaded in YouTube. And, you know, my hope is really to get to the community with this information, as well to people working in healthcare that can make use of the services and know how to refer patients to you. So I know that one of the populations that is highly impacted by, as you were saying, crisis and mental health crisis and family crisis are the Latino population. And unfortunately, you know, they are usually underserved. They have definitely, there is lack of services for Latinos. So Ivelisse, they told me you speak a wonderful Spanish. So if somebody in Spanish is saying this, do you mind translating those steps, which I think are very important for people to know how this works? You know, so if somebody happens to see this and speaks Spanish, they can understand how the process goes.
Mhm. So you want me to say it in Spanish? No pressure. Okay. So, los servicios de nosotros es para ayudar a familias en crisis o no crisis o circunstancias que puede afectar a la familia, a sacar a los niños de un problema con la escuela, puede ser que no se entienden con la familia. Entramos, nos ayudamos con servicios que puede ayudarlo para que la familia se unida y tenga más comunicación, un balance sobre los padres con los niños, porque a veces las palabras salen a las comunicaciones y los padres escuchan un problema y los niños no entienden lo que dicen los padres, y nosotros ayudamos con la comunicación, que se entiendan mejor. Le damos las referencias que necesita sobre otras organizaciones que lo pueden ayudar mejor. Y seguimos con las familias como 8 semanas, a ver si necesitan otros ayuda, más oportunidad para ayudarlos mejor. Y lo llamamos y estamos con la familia y buscamos otra gente que la pueden ayudar. I'm sorry. I tried my best.
Thank you, Ivelisse.
On the spot.
So now you said that you also look for other resources to help the families. So how does that work? Do you work in collaboration with other organizations, or do you have all of the needed resources within your team? How do the referral process happen?
So we have been trying to reach out to, our goal is to reach out to every organization in Rockland County. You know, we just started last month, but really trying to make affiliations so that we know what is offered in the county, and so we can say, all right, you could benefit from ongoing counseling. Here's a list of the places that we can refer you to. Or we can help them with, okay, so your school has a social worker. Here's the social worker's name and number if you're not familiar with them, because not all schools, you know, either have them or not all parents know that school social workers exist, right? It's a relatively new thing. So whatever we can do to help the family long-term to avoid needing a future intervention that's of this level. Now, does that mean that we wouldn't come back? Absolutely we would. But it's always nicer to be able to handle your own crisis and handle, you know, hopefully not even leading up to that crisis, be able to problem solve within a family, have that communication within a family, and get to where you need to be without further intervention.
If you already have a mental health provider, like if you're receiving services somewhere else, are you still eligible to receive services with you?
Absolutely. So we would request, and it doesn't have to happen, but we would ask if we could contact your current provider so that we're on the same page with what we're providing, and you know, ethically being within, not working against each other as clinicians, which is, you know, just always hard to work on two things at the same time. It can be very confusing for the child or the family. That being said, if somebody's like, I prefer you not speak to my therapist, that's okay. we're still going to come out and help with whatever you're stating that you need help with.
Mhm. Okay. Now, going back to the referrals, you say that you have like a whole list of resources in the community, but I know by experience, like a lot of families struggle making calls themselves, you know, like you can give them like a list of resources and they don't even know how to call the numbers. And I know this sounds kind of hard to believe, but honestly, a lot of people don't have that courage to call others and ask for services or resources or support or whatever it is. So how do you handle that?
Absolutely. We're more than happy to have an entire visit where we just sit and help with making those calls.
Mm-hmm.
You know.
And how long do you work with the families? You mentioned at some point that, you know, you do your intake and then you call the families again 2 weeks later to see how things are doing. So is that the end of the intervention, or do you guys continue working with the families a little longer?
So it really depends on the family, on the situation, and their needs. When we first do the initial phone call and kind of get a view of what's going on in the family, we're starting to talk about referral resources from that very first phone call, so that if for whatever reason we have a stopping point, we can provide the family with something. That being said, our goal is to do whatever we need to do within that 8 weeks to help the family get back on track. So whether, you know, I know the team's seen some families daily, some families weekly, some families have said come back in 2 weeks, and you know we'll talk about that. So it really just depends on the need and preference of the family. But the team is relatively flexible in being able to provide whatever services that they need to provide as often as possible.
Now, so you're talking about like kind of closing the loop in 8 weeks. If the crisis continues or there is another crisis, can families reach out to you again for either continuity of services or new services for a different crisis?
So I believe, you know, talking about further than the 8 weeks for continued crisis, you know, we would definitely talk about that on a case-by-case basis. After the 8 weeks, if there's a new crisis, we're happy to become involved again and talk about that. I would say at an 8-week point from my clinical perspective, we're talking about a family that needs long-term treatment. And so closing that loop is going to be, how can we become as involved as possible for a smooth transition, and really a warm handoff to saying, you know, you've trusted us for 8 weeks, and it's really hard to build that trust with somebody for 8 weeks. We want to help you trust this other practitioner or agency so that you can continue this journey that you've already started.
Yes. Do you want to tell us about like a case or something that you've done? I know we love to hear stories and that portray the good work that the care team is doing.
I'm gonna let Eva Meese do that. She's the one in the field doing the work.
Okay, so we have a case where it's a quite difficult one in a sense because there's twin brothers. They're 11 years old. One is diagnosed with autism, nonverbal. The other one is ADHD with ODD. And the communication between mom and the one with the ADHD is non-existent. So it creates a lot of chaos in the home. She has 2 kids. She's there with them all day. She's overwhelmed. There's a barrier of communication. So right now we're trying to create a system. We help them create a system with the mother and the child so they can understand each other better to regulate the behavior that one of the twins is experiencing with the mother. He wants his attention. He wants attachment with her. it's not there because her time is divided between the two. So we're working with them right now to help create a balance. Not perfection, but some type of a balance to de-escalate what's happening in the home right now.
That must be a lot of work indeed. Not just for you guys, but also for the families, right? So how do you do this? Do you go to the home?
Yes.
Or are you doing this through Zoom?
No, we visit the home. So far, we've had 3 visits. For example, yesterday we did a second visit for this week because they needed, but it wasn't a good time, so we have to respect that. And she's actually called me this morning. She wants to see us this week again. So we're building the rapport now. She called me. She wanted us to be involved. So we'll be following up with them again. It takes time, but at least they're willing to have us in their home, and the rapport is being built.
Mm-hmm. Now, if you're going to the homes, like this is the new COVID era. So what precautions are you taking when you're going to the homes?
So we screen, as Rachel stated. Have you been in contact with anyone? Have you been out of the country? Have you been, we screen that. Are we in danger before we get in? We ask about pets. We ask about any weapons in the home. We make sure we inform them. We want to be safe like you want to be safe. We ask you to please wear a mask. If possible, we try to be 6 feet social distancing away. So we do that before we go into the home. We screen.
Yeah, that's very good.
The only pets that have been loving, so
yeah. Now, what about other languages? Do you take families who don't speak English? Do you offer services in other languages besides English? I guess even at least you see families who speak Spanish. Any other languages that you guys offer?
So right now it's just English and Spanish. However, we do have access to a language line. So any families who need our assistance and are, and there's a language barrier, the team will contact our language line and we will use an interpreter.
And how many languages are there in your language line?
I would love to tell you, but I'm not sure. I know it's a great deal of languages. So I know for the needs of Rockland, definitely we have Creole on that list. And I'm positive there's probably over 30 at least. I'm sure there's more, but I don't want to give you a number because I'm not.
No, but that's great to know. There is so many. So that is really the answer that we were looking for. Is there something else that you would like to share? Like just one question that came from one of our attendees. How are you promoting these services? Because they are indeed very important. So how are you spreading the voice about the great work that you guys are doing?
So we were talking earlier about reaching out to all the different agencies when not doing outreaches. Evelise and Arthur are actually going to different organizations, different pediatric offices, schools, and community centers, and providing them with some marketing material and explaining what the program is and what we're doing, and talking about how can we work together.
Do you have any flyers or any brochures or anything like that you would like to share with me? That way I can just spread it to everyone who attended the meeting today.
Absolutely.
And
I'll provide you with some postcards.
That'll be great. That way, we can help spread the voice a little bit. And I'm sure that if people joined us today, it's because they are interested in learning more about the services and probably, refer patients to you themselves. Okay, so any other thing that you would like to share with us about your team? Who are the members in your team?
So it's a very small team. So in addition to Evelise, we have Arthur Lord, who's worked in the community for over 20 years, just providing different kinds of services with children and families. And he is the family peer advocate for the program. And we do run 7 days a week. So, you know, we have a number of per diem staff that work on their days off because, you know, they get to have days off too. And then we, you know, we can pull from our teams of if we need specialists. You know, we do have the 24/7, the substance use urgent care if a family needs access to that. We have a number of different specialists as far as psychiatry and clinical. So if there's a really specific issue going on in the family, you know, chances are that we'll be able to have the resources to assist. You know, and then really we're just very family focused. I think that's the number one thing that I'm trying to convey when people ask about the service. It's very driven by what people say they need, which is really important to us. You know, there's that whole nothing about us without us phrase, and we really do believe in that, and we want people involved, and encourage that all family members would be involved in the process. And if they don't want to, it's okay, and we will work with whomever, you know, would like to. But to facilitate real change within a family, it's so important to have as much involvement and participation as possible.
Mm-hmm. And Patrick from Health First, thank you for writing down your question. Thanks a lot. He says that earlier you said that there is no need for a medical diagnosis, but is that across the board or in a specific situations?
Across the board. We would love to know if there's a diagnosis. Clinically, it helps us out in assisting the family, but it's okay, you know, to not have a diagnosis and still be having trouble with your child. You know, and it's really common, especially when people first seek help, to if you've never had a provider involved before, then the chances are really good that your child doesn't have a diagnosis.
Mm-hmm. Right. And now Craig is asking a question. Craig is from Haverstraw, King's Daughter Public Library. Do you have a website for the service?
So we do not have a website for the service. That is definitely something that we could always look into. You know, but our agency's website is accesssupports.org.
You know my deal. I'm going to write it down. Access Supports with an S?
Yes.
.org. Okay. Accesssupports.org. Okay. Oh. Okay. .org. Okay.
Yep.
But can we find your phone number or something in there? If not, I'll repeat the phone number because I love doing that. 845-517-0400. And who's answering the phone over there? What's the name of the person?
So I don't know if it's a specific person. It's the behavioral health response team. And if anybody joined late, I'm going to explain again. Just the reason that we are going in that route is so that if there is an immediate emergency, they would be the responders for the immediate emergency, and they will pass any referrals on other than an immediate crisis to us, as long as they're having to do with children and family.
Okay, so let's say that I have a family who is in need of services and I think care team will be able to help them. Can I call this number and say, hi, can I talk to Evelise just because I know you, or Rachel, and, you know, be like, is this family eligible? And I'm just trying to troubleshoot here a little bit because, you know, we feel special because now we know you, and we want to cut some bounces here. So would that be okay to do?
So as a provider, I can be reached through email, and I'll put my email in the chat. If there's anybody that specifically would like to reach out, you know, we have attended people's teams meetings, and just given an overview of our program and discussed the services. And then as far as referral sources, you know, calling the bird team, they would say, you know, we can pass on your information, and they're really quick with it. When I say almost instantaneous, we get
Very
the email
good.
right away. So
Okay.
if anybody is looking to contact us, referral resources, really right now we're putting through the bird team. If at some point that changes, we will make sure that everybody's aware of it.
Perfect, thank you. Okay, and I'm sure that soon you're gonna be looking into creating a web page with all this great information, and I'm sure you will be doing it. But then again, if you share your flyers with me and your information, I'll be happy to pass it along for everybody who's interested. And I wasn't aware of the time, but we're actually running out of the hour. So I want to say thank you, thank you, thank you. If anyone has any other questions, please speak up, or do as Patrick and Craig, just write it on the chat before we go. But I just wanted to also say we have these webinars coming. Some of you already know we have these webinars happening every Thursday from 12 to 1 out of my office here in Montefiore, Nyack. We have 3 more programs for this month. One is on cardiac rehabilitation next week on the 14th, and we're going to be talking about cancer support the following week, and support for women with diabetes, a program called Diabetes Sisters. So we're doing a lot of community outreach this month and trying to provide you with many services for community members this month. So please, you know, just join us next week, help us spread the voice. There is always someone who needs services like this that we are promoting. So help us keep the programs alive and help the community at the same time. Yes, Kayla is asking if we can get the recording definitely by the end of the day today. As a matter of fact, after I finish this one, we're gonna have another one on COVID vaccines, which is gonna be going out to the community very soon. So we're gonna have a big one on COVID. This, the one that I'm doing today, is only for healthcare providers, but we're gonna have another one on COVID for the community. And so as soon as I'm done with that, I'm gonna be creating the recording for this presentation, and I'm gonna be sending it to all of you and all the people who registered that couldn't attend today. So yes, okay. So those were all the questions that I had. If no one else had any other questions, I'm gonna let you go. But first, I want to say thank you. Thank you so much for everything that you're doing. The work that you're doing is amazing. And, you know, like, people need so many mental health services, and especially children, and especially in Spanish and other languages. So I appreciate very much the idea that you have and that you're making it alive and possible for people and families here in Rockland County. So thank you very much. Thank you, Patrick. We'll hope to see you next week again. And everybody else, Craig, Michelle, Aeneas, Kayla, and whomever is joining us on the phone over there. And we'll see you next week. Thank you for joining.
Thank you for having us.
Thank you. Thank you for having
Of
us.
course, a pleasure.